Mr. Chairman, thank you very much. Secretary, thank you for joining us. Thank you for your phone call inquiring about anything that we were interested in visiting with you about. I'm always interested in a number of issues that face rural hospitals, community pharmacists. I would again express my gratitude for the times that CMS in particular, but your department has worked with us to try to solve individual issues that create what appears to be insurmountable problems for a community attempting to deliver health care to patients in the region. And I just would thank you for the past cooperation, ask you that you would continue that and encourage the folks who work with you to understand the distinction and the difficulties that many small-town rural providers face. Let me focus a moment on NIH and perhaps, and I apologize that I was in the Commerce Committee, but perhaps you've addressed this, but the mandatory issues that your budget raises are troublesome to me, particularly in light of what occurred last year. Congress is stepping up and increasing the support under the leadership of this subcommittee and our full committee. And I would encourage you to work with us on budget solutions that are likely to occur once you continue to propose, in some instances, user fees. I chair the subcommittee on Food and Drug Administration's budget. User fees there, mandatory spending here are unlikely to be solutions to the budget challenges that you believe your department faces. And then I wanted to ask you a specific question related to the state of California. This involves the issue of healthcare provider coverage for abortion. Religious entities, as you would know, have moral objections. They are protected by something called the Weldon Amendment. You were asked a year ago about this issue and indicated that an ongoing investigation was occurring. The allegation is, as you know, that California requires its providers to provide abortion services. That presumably violates the Weldon Amendment that prohibits that requirement. Your answer a year ago was that the investigation was occurring and it would be completed expeditiously. It's now a year later, and my question is it the opinion of the department that the order of California is a violation of the Weldon Amendment?
With regard to this issue, I think you know when it was raised with me, both externally but raised by members of Congress, we opened the investigation with the concerns that had been expressed. The investigation is still open, so my ability at this point to comment specifically on the question you asked, we need to wait for the completion and the finalized investigation for me to comment on the specifics of what the outcome of that investigation is. And so we are not there yet, and when we are, we will make sure we communicate.
The investigation has been ongoing for how long?
The investigation has been ongoing for well over a year.
And do you have any opinion as to when that will be concluded?
My hope is that it will be soon. I wish I could give you a timetable, but I don't want to do that because it is an open investigation.
I will let my question stand for my concern, criticism. I'm worried that this is an issue, as you know, that has differences of opinion about the outcome, but in my view, the law is clear, and California is violating the law. It's the administration's responsibility to enforce the law, and I worry that there may be a plan afoot in which this just continues to the end of your term and the end of the administration as compared to fulfilling your responsibilities.
I hear your concern, Senator.
Thank you, Secretary. Thank you, Mr. Chairman.